Ever pondered the paradox of a person who seems high-achieving and perfectly in control on the outside, yet battles an inner storm of sadness and despair? Welcome to the enigma of high-functioning depression. The term high-functioning might sound like a positive spin, but it's far from it. High-functioning depression, also known as dysthymia, is a persistent depressive disorder. It's a chronic form of depression that's less severe, but longer-lasting than typical depression. Dr. John M. Grohol, a renowned psychologist, explains high-functioning depression as a veil of achievement and normalcy that hides a person's inner turmoil. It's a silent struggle, often unnoticed by others. So what does high-functioning depression look like? According to Dr. Michael E. Thays, a professor of psychiatry, individuals with high-functioning depression meet their responsibilities but often without joy or engagement. They may excel at work, maintain social relationships, and even have a seemingly perfect family life. Yet they grapple with constant low mood, fatigue, and a sense of hopelessness. Psychotherapist Dr. Jody Eisner emphasizes that people with high-functioning depression are not lazy or uncommitted. They are battling a silent war every day. They put on a brave face and keep going, often without anyone realizing the depth of their struggle. The danger of high-functioning depression lies in its subtlety. It's easy to dismiss the symptoms as mere bad days or feeling blue. Yet, when left untreated, it can lead to severe depression, anxiety disorders, and even suicidal thoughts. Dr. James Murrow, an assistant professor of psychiatry and neuroscience, warns, high-functioning depression can lead to a significant decrease in quality of life, even if it doesn't cause total dysfunction. It's a serious condition that requires attention and care. So how can one address high-functioning depression? The first step, according to Dr. Raman Mojtabai, a professor of mental health, is recognition. Acknowledging the struggle is the first step towards seeking help, he says. This includes recognizing the symptoms in oneself or others and understanding that it's okay to seek help. Treatment options are varied and can include psychotherapy, medication, lifestyle changes, and mindfulness techniques. The best approach often depends on the individual's unique circumstances and needs. In conclusion, high-functioning depression is a complex condition that wears a mask of normalcy. It's a persistent, low-grade depression that can persist for years, often unnoticed. It's a silent struggle, hidden behind a facade of functionality. Remember, mental health is as crucial as physical health. Acknowledge the struggle, seek help, and remember that it's okay not to be okay. Because, as psychiatrist Dr. K. Redfield Jamison once said, "The bravest thing I ever did was continuing my life when I wanted to die." High-functioning depression is a silent battle, and acknowledging it is the first step towards victory.